Let's discuss the question. We have a 25-year-old man and he complains of cough, chest discomfort and dyspnea and he comes to you. He lost a considerable amount of weight in the last 2 months. He has a 10-pack year of smoking history and physical examination is unremarkable. Chest X-ray reveals a large anterior mediastinal mass. Well, I mean, in the blood workup, the elevated level of beta human chorionic gonadotrophin, that is beta HCG, and alpha fetoprotein, both are raised. Most likely diagnosis. The answer is non-seminomatous germ cell tumor. Patient has a large anterior mediastinal mass with an elevated level of beta HCG and AFP. Okay. So three things to be remembered in this particular slide. And these three findings are consistent with non-seminomatous germ cell tumor. Well, this is a primary mediastinal germ cell tumor, predominantly in young males. Our patient is a 25-year-old male and they are locally invasive. Well, now very important point. Beta HCG is elevated both in seminomatous and non-seminomatous germ cell tumor. But non-seminomatous also produces alpha fetoprotein, which is not produced by seminoma. So elevated level of beta HCG and alpha fetoprotein are there in our patient. Well, a large mediastinal mass with the associated alpha fetoprotein and beta HCG virtually diagnostic of a non-germ cell. In fact, this is the most important line. If you remember this, this question is complete in all the aspects. Well, we can confirm by biopsy, no doubt about it. Well, this is a non-seminomatous germ cell tumor of and it's ultrasound of the testes. Okay. Now, little bit extra knowledge. Extragonadal germ cell tumor are there in pineal gland, mediastinum, heart, lungs, peritoneum, and retroperitoneal. Well, all germ cell tumor are in the anterior mediastinum are primary rather than metastatic. There's something unique about it. They're all primary. They're usually not metastatic. Now, you can see the testicular ultrasound would be performed to exclude a primary tumor because management differ completely in primary and secondary, although metastasis is very uncommon, but it's a mandatory to do the testicular ultrasound. Okay. Now, let's talk about other options. Unlike in female, mature teratoma in adult males may be malignant, but they are benign in children, or they are benign in females also. Benign teratoma usually include tissue from all the three germ cell layers. It may represent as a mediastinal tumor. They do not produce any tumor markers. So, but in our case, there is a elevated HCG and AFP, so this is ruled out automatically. Point to note, it produced no tumor and they have all three germ cells. The two keywords to be remembered in this particular slide. Well, you can see the typical case of teratoma. This is a much better picture. You can see stratified squamous epithelium, respiratory epithelium, cartilage, hair follicle, intestinal gland, adipose tissue, thyroid tissue. So it has got all the three cell lineage tissues are there. Let's talk about option B. Choriocarcinoma is a very rare, can develop during or after pregnancy in a mother or even baby also. They are the malignancy of trophoblastic tissue. Okay, that means cytotrophoblast or syncytotrophoblast. There is no chorionic villi present. Point to be noted very carefully. So they are from trophoblastic tumor. They are type of gestational trophoblastic disease, to be more precise. This is the only keyword that you got to remember in this particular slide. They usually occur in the setting of molar pregnancy, very, very important point. Increased frequency of bilateral or multiple theca luteal cells is additional thing that can happen in these patients, and they may present with shortness of breath and hemoptysis. Hematogenous spread into lungs and brain. Beta HCG level are increased significantly. Point to be noted. Okay, these are typical historical finding of these. But there may be symptom of hyperthyroid in these cases. The reason being symptom of hyperthyroidism. HCG structurally resemble to LH, FS and TSH also. This is a very, very important point, that they have resemblance to other TSH hormone, and that's why they may have feature of hyperthyroid also. Well, this is the early placenta develop into abnormal cyst, and this is the ultrasound of the choriocarcinoma, typical finding. Now option C, Hodgkin lymphoma, is a common cause of mediastinal mass with the weight loss in young patient. Well, just to inform you, Hodgkin lymphoma has a bimodal presentation. It may occur in young people also, like in our case, age, or it may be elderly also. But our case, the young patient and with weight loss, but definitely it's not a case of Hodgkin lymphoma. The reason being, AFP and HCG are not raised, and in this there may be cervical, supraclavicular and axillary lymph node are enlarged. That is one of the clue that we are getting maybe towarding Hodgkin, but these are not raised, so this option automatically rules out. Well, look into this. This is a histology. What is this cell known as? It's a very easy question. It's a biopsy sample from Hodgkin. Stop the video, write down the answer. These are Reed Sternberg cells. Whenever you get this word, 99.9% you are dealing with Hodgkin lymphoma. Okay, just see, lovely. They are all appearance of nuclei. This is the mediastinal mass, hilar adenopathy also you can say. Now what about thymoma? Is a neoplasm of the thymus. Okay, this the thymus gland is there in the anterior mediastinum. Well, this partially mass in the anterior mediastinum with regular margin and bulging in the upper mediastinum contour type. This is thymoma, X-ray. Now, they are associated with which condition? Myasthenia gravis and pemphigus also. Again, a very important question. This is a very, very important question. It is such an important question. Whenever we get a case of myasthenia gravis, you should always investigate for thymoma. Thymoma may or may not be there, but it should be investigated. This is pemphigus. Pemphigus. Golden line to remember. Germ cell tumor typically affects young patients and display aggressive biological behavior. Non-seminomatous germ cell tumor typically produce both alpha-fetoprotein and beta HCG. Now, one more thing. Serum tumor markers, they should not be used as a primary tool for cancer diagnosis or screening. Especially for diagnosis, should not be used. They are usually used to monitor tumor recurrence and response to therapy, but definite diagnosis should be always made by biopsy.